In June 2015, the National Institute for Health and Care Excellence introduced new guidance for cancer. That was specifically about suspected cancer and the recognition and referral. And this has since replaced all the old guidance. And one big benefit is now we have got evidence-based guidance. And a lot of that evidence has come from primary care research. The key issue is to save lives. It is about early diagnosis. The sooner that cancer is found, the better the outcomes for patients. It's also about shifting the route to diagnosis, reducing the number of people who are picked up with cancer in A&E and helping GPs and primary care manage those patients and pick up that cancer earlier. I think the other important issue is about standardising the process. We know there's considerable variation across the country for pathways to try to detect cancer, and what this tries to do is to reduce that postcode lottery and improve things everywhere. These new guidelines cover the symptoms and signs that could suggest cancer, and they give specific recommendations of what to do if faced with those symptoms and signs. So for example, when to do a referral, when to do a test, and how quickly to do the test. But they go further than that because they also help with some recommendations on safety netting of patients, for example, when to ask them to come back. And finally, the other thing that they cover is more detailed information and support for patients and the carers if they're in a stage where cancer is suspected. The key change here is about the threshold for referral has been reduced. In the past, we were recommended to refer if a symptom or sign, or several symptoms or signs, had a 5% risk of a patient having cancer. The new guidance lower that to 3%. So of course there's going to be increased numbers of referrals. Some of the guidance goes even further than that, for example, particularly with children and young adults, having an even lower threshold for referral and even pushing the timelines quicker than 2 weeks. Another major change is about access to investigations. There's recommendations here for when in primary care to organise urgent tests. So for example, when to do an ultrasound scan, when to do a CT, when to arrange an endoscopy. And one last change, which in a way can make it easier to read, is rather than the guidance just being tumour specific, it defines it in the term of symptoms and signs. So you can cross-reference one particular symptom and get some advice of what to do about that symptom. People don't come saying, I've got bowel cancer. They come into GPs saying, I've got abdominal pain. There is a list of potential issues and potential cancer diagnosis for people with abdominal pain and some advice on what would be the appropriate investigations or referral for those patients. The immediate impact that we're going to see here is of course a significant increase in the number of referrals and investigations for cancer, but the potential savings are huge here. It's estimated that if we all adopted this guidance, we could reduce the number of cancer deaths in England by 10,000 patients per year. So my message to my GP colleagues out there is this guidance is here and it's here to stay. I respect it's a change, I respect it's different, and I respect people have got to get their heads around it. But equally so, just think about the potential that we've got here. Just think about the fact that we can actually pick up cancer sooner. We have better pathways for diagnosing patients. We can save lives and we can give our patients a better quality of life.